Hello everyone! Thank you for taking the time to come to my presentation entitled The Perceptions of COVID-19 and the Use of Health Information Technology Among People Who Are Uninsured. My name is Khushi Patel and I'm a freshman nursing major at the University of South Carolina Honors College. Before I start, I want to give a quick thank you to Dr. Cynthia Corbett and Ms. Elizabeth Coombs, who worked directly under for this project, and to Dr. Sarah Donovan, Dr. Margaret Self, Dr. Robin Dawson, and Dr. Rhonda Hughes for their contribution to this research. The novel coronavirus, COVID-19, has taken over 2.8 million lives globally and over 550,000 in the U.S. alone. The risk of infection due to COVID-19 is much higher in uninsured populations due to several risk factors, including low health literacy, reduced access to care during illness, and densely populated living situations. Low health literacy refers to decreased access to information, which can in turn lead to a lack of appropriate knowledge and infection precaution, as well as being unable to determine when to seek care if ill. In addition, people who lack health insurance are often employed in positions that do not offer benefits such as sick time, and they may also fear job loss if absent, therefore being more likely to continue to work when ill. Uninsured populations also often reside in densely populated communities, leading to a reduced ability to isolate as a result of more people per residence. The objectives of the study were twofold. First was to explore the experiences of uninsured adults regarding COVID-19, including their knowledge of disease symptoms and other risk factors. Second was to understand the perceptions within this population of a healthcare app designed to monitor the physical and mental health symptoms of COVID, understand possible safety concerns, and facilitate access to community resources to better address these symptoms and safety concerns. This research was conducted using an anonymous survey administered to a convenient sample of uninsured adults seeking care at a free clinic. The respondents of the survey were questioned regarding their awareness of the coronavirus, including what behaviors help mitigate its spread, as well as their current technology use. Data was collected and analyzed using frequencies and means. The demographics of the study consisted of a sample of 126 adults with an average age of 48.3 years. The sample had a pretty even split among gender, with 52.4% male and 47.6% female respondents. 48% of the participants had previously tested for COVID, of which only 3% tested positive. As you can see in the ethnicity graph, the sample was majorly black, followed by white. As per the objectives of the study, one of the major themes of questions we asked in the survey surrounded patient perception and knowledge of COVID-19. We actually asked the participants in the study if they believe themselves to be at risk for COVID. The graph of the responses can be seen in the red box in the middle of the poster. 73% of participants said that they were not at risk for COVID-19. We further broke down this response by asking why they believed they were not at risk, to which 14% said that it was because they were young, healthy, or previously hadn't had any health problems. Underneath this graph is a chart reporting on the sources used to learn more about COVID. Here we can see that TV is the most used source, while social media is the least used. To the left of this chart is a graph on the safety steps participants used against COVID. Interestingly, only 24% of participants said that they used a mask, and 9% actually reported on not taking any precaution. We also inquired about participants' knowledge of COVID-19 symptoms and found there to be a high overall knowledge in this area. We were able to compare the respondents' symptoms with those currently reported by the CDC on their website. This cross-examination revealed that 97% of participant-given short-term symptoms aligned with those reported by the CDC, and 73% of long-term symptoms aligned with those reported by the CDC. We also asked respondents to rate their understanding of symptoms on a scale of 1 through 5, 1 being not at all and 5 being completely. The charts corresponding to these questions can be found at the very bottom of the middle section of this poster. As you can see, respondents were majorly confident in their understanding of both short and long-term COVID symptoms, which align with the graph above on the alignment of reported symptoms with what is currently released by the CDC. The second major objective of the study was to understand the access to technology within a population of uninsured adults. It was found that 88% of participants had access to some form of technology that allowed for internet, and 75% of participants actually stated that they were open to using a healthcare app. Based on these results on participant knowledge of COVID-19, the major theme we found, as previously stated, was that there was a high overall knowledge of COVID-19 and that the majority did not think that they were at risk for COVID. We also found that many people do not get their information about COVID directly from healthcare providers, but rather from alternative sources like TV, news, and internet searches. In terms of technology use, the big takeaway was that there was a large percentage of population that had access to some form of internet, allowing for the use of the healthcare app. Speaking of the app, there was an overall positive response on the creation of this healthcare app. The limitations of this study consisted of 3 main factors. The first being that some participants did not complete the entirety of their survey, allowing for some discrepancies in data. The second was that the study only examined a convenient sample of participants from a single clinic, meaning the sample may not be indicative of the whole population. The final factor was the time frame of the study. The study took place between December of 2020 and February of 2021. This is a snapshot of the progression of the pandemic, and with the release of the vaccine, it does not take into account any changes in the perception of COVID following the administration of the COVID-19 vaccine. I'd like to thank USC's Acorn Center for partial support of this research, as well as the participants who responded to the survey and the clinic's staff for facilitating research. Thank you again for coming to my poster session, and please feel free to contact me at my email, khuship@email.sc.edu if you have any questions. Thank you and have a great day.